Infertility is a very important topic. Many patients, unfortunately, try to conceive naturally and it doesn't happen. Some people are more anxious about fertility than others, but nowadays, because pregnancies are happening a little later, the fertility problem is becoming a little more accentuated. We know that when we get older, the fertility drops. And this is why we're having more infertility these days than in the previous days where people used to get pregnant when they were younger. But for the infertile couple, before we say that there is infertility, they have to have unprotected sex for the whole year without getting pregnant. And this is if we're talking about people that are younger than age 35. And above the age of 35, we say at least 6 months of unprotected sex to say if the people are infertile or not. If the couple is infertile, they did this and they did not get pregnant, then we have to investigate both really, the male and the female, because multiple causes of infertility are there. There is the female factor and there is the male factor. For the male factor, the way we investigate for is we do a sperm analysis to check the sperm, and depending on what is the parameters on the sperm, we decide if we need to do any extra testing or not. While for the female, it's a little more complicated because infertility can be due to multiple things. We're going to start with the hormonal problem or the ovulation problem, where there is multiple problems that can cause ovulatory problems in a female. There is first like a premature menopause, or when the patients lose their ovarian function younger than they're supposed to and they stop having their periods. When you have this situation, you have to check some hormones to see if they are high or not, and you have to check why did this happen, because this is not something that is common. And depending on your investigation, you will know how to treat the patient to help them getting pregnant. Another problem with ovulation, you have polycystic ovarian syndrome, which is very common in our area in the world. And this is an area where people don't ovulate normally, they have excessive hair, they have acne, they're obese, etc. And on an ultrasound, they have a polycystic appearance of their ovaries. So those people that don't ovulate regularly, you need to kind of boost their ovulation to be able to get some eggs out, to be able to help them with the fertility. The third hormonal problem that can cause infertility is hyperprolactinemia. And this is when you have the prolactin is high. It's a hormone secreted from a part of the brain and usually helps with bringing the milk during breastfeeding. But sometimes there might be a small tumor in the brain that causes increase in this hormone, and that can affect ovulation. And when it affects ovulation, usually you don't get pregnant. So the treatment would be to decrease that hormone level to a normal side, and then people can try to get pregnant with no problem. Those are mainly the three ovulation problems that can induce infertility. But there is also some other problems. You have, ovulation, and then you have the tubes. The tubes usually carry the egg and the sperm to meet together before they drop in the uterus to hang up in the uterus. So you have to make sure that these tubes are open to be able to get pregnant. And many factors can affect these tubes. If you have previous surgery, if you have previous infection, if you have previous tubal ligation, they might affect your tubes. And the way to look at these tubes is to do something called hysterosalpingogram, where you inject a dye inside of the uterus. That also would help so to see the contour of the uterus to make sure there is not in the uterus itself. And then it will spread through the tubes inside of the abdominal cavity, so you would see if the tubes are open or not. If the tubes are not open, then you cannot get pregnant. You either have to go open the tubes by surgery, or you have to proceed into something called IVF, or in vitro fertilization, and put the embryos back in the uterus. Then you have to assess the uterus, and that you can do the same way. You have the cervical factor, which is basically when you're having intercourse, the sperm has to cross through the cervix to get inside. If the cervix is damaged due to a previous surgery, or if it's closed by a congenital malformation, you cannot get pregnant. Those are the main things that we usually look at. So the way we investigate is we check some hormones to see if there is any hormonal imbalance, to see if there is any premature menopause, to see if there is PCOS or hyperprolactinemia. We check the tubes to make sure they're open, and then the same way we check the cervix, the uterus, and we check the sperm in the husband. And wherever the problem is, we usually treat it. Sometimes you do all of these things and everything is normal, and this is what we call unexplained infertility. And if this happens, we usually try to boost the ovulation, take care a little bit of the sperm, and support the pregnancy for it to happen. So many reasons can cause infertility, Age is one of them. Try to get pregnant a little early. Don't delay your pregnancies until a very older age, because fertility do drop with ages. If you've been trying to conceive for 6 months or 1 year and you're not getting pregnant, then visit your doctor to do the investigation we just talked about.